The topic today is about cardiovascular drugs, and these drugs are drugs which affect both the heart and the blood vessels. So, these are the cardiac glycosides, the antianginals, antidysrhythmics, diuretics, antihypertensives, anticoagulants, the antiplatelets, the thrombolytics, the antilipidemics, and peripheral vasodilators. So first, the cardiac glycosides, specifically the digitalis, it's a drug effective to treat congestive heart failure. Now, what is congestive heart failure? A very brief explanation of congestive heart failure is shown in the drawing here. The healthy heart versus a congested heart that is failing in function. Pag merong congestive heart failure, think of two main problems of the heart. First is the heart failure itself, meaning there's an inability of the heart to pump blood effectively. And second is the congestion. Because of its failure to pump blood effectively, nagko-congest ang heart, which means hindi siya effective mag-pump, kaya hindi niya na ilalabas lahat ng dapat niyang ilabas doon sa loob ng kanyang chambers. Okay? Ang CHF or congestive heart failure ay maaring right and left side. Right side heart failure versus left side heart failure. Regardless if it is right side or left side of the heart, parehong may tachycardia. But when we talk about left side heart failure, mas nakafocus ang symptoms nito sa pulmonic symptoms. Kapag naman right side heart failure, nakafocus ang sintomas nito sa pulmonic or systemic symptoms. Okay? Ang CHF ay laging mangyayari dahil may dahilan. Usually, CHF is just a complication of another heart problem. Maaaring dahil pinanganak yung bata na may butas sa puso, hindi na-treat yun, hindi na-manage agad, nagka-CHF. Or isang matanda na nagka-infection ng heart, hindi na-manage agad, nagtagal, ganun din, nagka-CHF. So, in reality, the best is always treat the underlying cause. The CHF itself can be treated with digitalis or cardiac glycosides. But if the underlying cause will not be addressed, uulit lang din posible ang CHF. Okay? Now, ano ba ang digitalis? It's a group of drugs that actually inhibit sodium and potassium pump. It results in increasing intracellular sodium and influx of calcium. When that happens, the cardiac muscle contracts effectively. Sabi nga natin, no, the heart, kapag siya ay nahihirapan, it always compensates. It compensates by beating faster. Mas bumibilis ang tibok ng puso. That's why CHF is characterized by initially tachycardia. Pero, pag nag-improve na yung fiber contraction, syempre, ang mangyayari doon, babagal. Ang tibok ng puso, magiging effective yung functioning niya, at mawawala yung congestion. What are the effects of digitalis on heart muscle specifically? There's positive inotropic action, kasi nga magi-improve yung myocardial contraction and of course, improving the stroke volume. Stroke volume is the amount of oxygenated blood na lumalabas sa aorta every heartbeat. Lub-dub. And usually, gaano karami yung oxygenated blood na yan? Nasa 80 to 120 ml. Cardiac output, on the other hand, is the amount of oxygenated blood that exits the aorta for 1 minute. Kung ang stroke volume every heartbeat, ang cardiac output every 1 minute, and that is about 5 to 6 liters of blood. and that is enough to supply oxygenated blood sa system ng ating cells. There's also negative chronotropic action, which now then increases or decreases the heart rate. Bumabagal na yung heart rate kasi effective na nga yung contraction. And there's also negative chromotropic action, which decreases conduction of heart cells. Hence, nag-i-improve yung myocardial contractility. Now, digoxin or lanoxin is a rapid-acting digitalis. It's a secondary drug for heart failure. It can be given per oral or IV. Bakit secondary drug? Kasi nga, aside from heart failure, meron pang congestion sa CHF. And the first drug will also address the congestion, which we will discuss later on. Okay? Now, when you give digoxin or lanoxin, it's important to give it 1 hour before or 2 hours after feeding on an empty stomach for better absorption. Take apical pulse for 1 full minute. Hindi pwedeng 15 seconds and times 4 because you have to accurately get the heart rate. Dahil sa CHF, heart rate o yung mismong tibok ng puso ang ating minomonitor. It should be apical for a typical adult. It's in the 5th ICS left mid-clavicular line. You have to check it using stethoscope and not the pulse rate. Also expect that colored vision and diarrhea is common, but of course it may resolve eventually. Important also that when giving digoxin, monitor the potassium level. If less than 3.5 mEq per liter, you have to hold the dose and stop digoxin. Why? Because digoxin is a drug which has a low therapeutic index, which means merong possible digoxin or digitalis toxicity even if you give this drug at the right dose, at the right route, at the right time, right computation, dahil sadyang meron siyang low therapeutic index or narrow margin of safety, meron pa ring risk of toxicity. And a decreasing potassium level in the blood will increase digitalis toxicity. So monitor potassium with digitalis. Now, how do we monitor the digoxin levels? 0.8 to 2 micrograms per liter. Yun lang yung normal acceptable range in the blood. If it is more than that, it may already indicate toxicity. And what should you check out? Check for nausea, anorexia, vomiting, lethargy, and bradycardia. If there is already signs of toxicity, of course, aside from stopping the drug, you have to give the antidote. It's digoxin immune fab, ovine or digibind to treat severe digitalis toxicity. Next is antianginals. Angina pectoris is acute cardiac pain lasting for a few minutes caused by inadequate blood flow to the myocardium due to plaque occlusions or spasms of the coronary arteries. Angina pectoris is a precursor for myocardial infarction. Kung sa MI, zero oxygen supply na sa heart, ang angina pectoris, hindi pa siya zero, but there is less oxygen supply. Kaya reversible pa ang angina pectoris. There are 3 kinds: classic or stable. It occurs with rest or exertion, or stress, or exertion. Unstable, it's the pre-infarct. It occurs frequently over the course of a day with progressive severity. And third is the variant, the Prinzmetal or the vasospastic. Ito yung pinakadelikado, it occurs even at rest. So sa angina pectoris, ang goal natin is to give drugs that will improve blood flow to the heart. para yung less oxygen supply maging more at maging effective. And magi-increase yung blood flow, magi-increase yung oxygen supply, therefore magi-increase yung oxygen demand ng myocardium. There are three general classes of antianginals which will all improve the blood supply. And that is one, the nitrates. The variant antianginals reduces venous tone, which decreases workload of the heart and promotes vasodilation. Yun nga lang, si nitrates, headache is very common. It's a common complaint of patients taking it. But again, it will diminish with time. Meron ding mga nitrates na patch ibinibigay or sa skin. So it's important when you give these drugs, you will only replace it if the old one will fall off. Yung mga nitrate patch din, do not give it sa mga part ng body because it's chest pain na may mga hair. The hair will interfere with the absorption of the drug. Beta blockers, on the other hand, classic, decreases effects of sympathetic nervous system stimulation, which will then decrease the workload of the heart and will further decrease the oxygen demand. And lastly, the calcium channel blockers variant, they inhibit calcium action within the myocardium. So magdi-decrease ang workload ng heart and magdi-decrease din yung oxygen demand. These are the drugs. So nitrates, nitroglycerines, isosorbide dinitrate, and isosorbide mononitrate. So pag sublingual, tinutunaw sa ilalim ng dila, nitroglycerin sublingual can be given only for 3 doses. Posibleng every 5 to 15 minutes apart. No? And then, beta blockers, the olols, of course, very specific sa beta 1 because yan ay receptors found in the heart. And the calcium channel blockers. Ang mga calcium channel blockers, it's important also to take the pulse. No? Always monitor the pulse rate naman for 1 full minute. And again, dito, dizziness is common. It's a common complaint. Next is antidysrhythmics. Cardiac arrhythmia or cardiac dysrhythmia is any deviation from the normal rate or pattern of the heartbeat. Ang normal heartbeat natin, lub-dub. Okay? This is a normal ECG tracing. P wave, QRS complex, and T wave. This will be further discussed to you sa med-surg nursing, but just a very brief overview, recalling the anatomy and physiology of the heart, the upper chambers are the atria, and the lower chambers of the heart are the ventricles. The atria pumps to collect blood. Left side collects anoxyblood, right side collects oxyblood. The ventricles pump to pump blood. Okay? The right side ventricle pumps an oxyblood going to the pulmonic circulation, while the left side of the heart, the left ventricle, pumps oxygenated blood going to the systemic circulation. And after the pumping movements, of course, there's a recovery time or relaxation. And in an ECG tracing, yun yung P, Q, R, S, and T. The P wave is actually representing the atrial contraction whenever the right and the left atria collects blood. The QRS complex represents the ventricles pumping blood, the right and the left ventricle. And the T wave is the recovery time or the relaxation time. And in a normal heartbeat, this is how it looks like. If it is fast, it's like this, but still regular ang pacing. If it is low, it's like this, but still regular pa rin, no? Andun pa rin yung usual PQRST complex at regular yung kanyang dating. Pero pag irregular heartbeat, may iba-ibang klase ng mga interpretations. So, the normal sinus rhythm is this one. This is sinus tachycardia and sinus bradycardia. Pero yung mga irregular, marami ng ibang interpretations, which we will further discuss sa med-surg nursing. Okay? Ngayon, basta't may irregularity sa rhythm. Ito kasi yun eh. Pag may irregularity sa rhythm, may mga antidysrhythmics to regularize the rhythm. Class 1, sodium channel blockers, procainamide, quinidine, and lidocaine. If you recall, si lidocaine, isa itong emergency drug na makikita sa emergency cart. Meron kasi siyang anesthetic effects to the heart, lalo na pag may irregular heart rhythm. Class 2 are the beta blockers. Ito ulit yung mga olols because they can improve blood flow also to the myocardium of the heart. They can also regularize the rhythm of the heart. Class 3 are drugs that prolong repolarization. When you say repolarize, it means the heart relaxes. Depolarize is the heart contracting. So if you want to prolong relaxation, you're also improving the rhythm of the heart. Class 4 are the calcium channel blockers, which again improve myocardial contraction. And the others, phenytoin is a drug for prevention of seizure. Digoxin is a drug treating congestive heart failure. And both drugs also have been seen to have effect on regularizing the rhythms of the heart. Okay, next are the diuretics. Diuretics means they initiate urine formation. They increase urine flow. They promote diuresis. How do they do that? They inhibit sodium and water reabsorption from the kidney tubules. Of course, it's the kidney which produces urine. And diuretics are used for two main processes. One, they can decrease hypertension. And second, they can decrease edema. Okay? Now, when we say decreasing hypertension, this is because pag pinadami yung paglabas ng ihi, nababawasan ng blood volume. Increased urine production will decrease blood volume because when you filter blood, no, urine ang product nun. Kaya pag mas maraming ihi, mas konti ang natitira na blood volume. That's why there is vasodilation. And we know that vasoconstriction is an etiology of hypertension. Second is edema, or any kind of congestion, including congestion of the heart, which is, yung sinasabi ko nga kanina, na primary drug din for congestive heart failure. Because if there is more water, increasing urine flow will prevent the congestion or edema on a body part. There are several categories of diuretics: the thiazides, the loop, the osmotic, the carbonic anhydrase inhibitors, and the potassium-sparing diuretics. No? And before we specifically or discuss them one by one, let's have a review of how the kidneys produce urine. Because it's also the same mechanism how diuretics increase urine formation. This is the kidneys, and the cells of the kidneys are called nephrons. So ito ay isang nephron na nasa loob ng kidney. The nephrons have glomeruli and the renal tubules. And the renal tubules are the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and the collecting duct. Whenever we filter blood, blood goes here in the afferent arteriole. So ano ba ang components ng blood? RBC, WBC, platelet, and plasma. Ang nafi-filter lang ng glomeruli, of course, ay yung mga particles na magpa-pass through ng drain. RBC will not be filtered. It's big. WBC will not be filtered. Platelet will not be filtered, but only plasma. Pero sa plasma, may malaking particle dyan na hindi rin mafi-filter. At yun yung plasma protein. So, RBC, lalabas ng efferent. WBC, lalabas ng efferent. Platelet, lalabas ng efferent. Plasma protein, lalabas ng efferent. So, ano lang ang na-filter or ano lang yung dumiretso dito? Sa proximal convoluted tubule, it's plasma minus protein. Ang tawag doon, filtrate. That's the first step of urine formation. That's how it was filtered. Ngayon, as you go through along this proximal convoluted tubule, the filtrate is plasma minus protein. Hindi pa urine yon. Pero ang dami-dami doon sa filtrate kasi plasma siya minus protein. Nandun lahat ng nutrients, nandun ang gases, nandun ang hormones. At hindi mo yun pwedeng ilabas sa urine. That's why the second step of urine formation is reabsorption. Ang karugtong ng efferent arteriole na ito ay isang peritubular capillary. So lahat ng mga kailangang i-reabsorb dito, babalik sa peritubular capillary. Marireabsorb. Because you need to bring that to the systemic circulation. And lastly, lahat ng nandito naman na kailangang itapon. Remember, may mga hindi na filter initially. Tapos, example pa, yung mga drug waste products. Kailangan ngayong matapon pabalik dito pa rin sa renal tubules. At yun yung third step of urine formation, yun yung tubular secretion. So, na-filter, ni-reabsorb, and then sinecrete. Hanggang pagdating dito sa dulo, urine na lang siya. It's ready to come out. Ang mga diuretics along the way, nandoon yung mechanism of action nila. Usually by preventing reabsorption. Kaya dumadami yung water as it is being excreted in the urine. Okay? So the first diuretic is thiazides. It's effective for edema. Ito yung sinasabi kong iba-ibang mechanism of actions. Sa distal convoluted tubule yung action niya, beyond loop of Henle, promotes sodium, chlorine, and water excretion. Pwede siyang gamiting antihypertensive because it can act directly on arterioles to cause vasodilation, but only for mild hypertension. Hindi pwede yung mga severe. It causes loss of potassium, sodium, magnesium, promotes calcium reabsorption, and increases glucose in the blood. If you look at this, if it causes potassium loss, you have to watch out carefully when you give diuretic with digitalis. Because remember, if there is increased loss in potassium, tapos nagbibigay ka ng diuretic, nag-i-increase ang risk of digitalis toxicity with every potassium loss. Kung meron namang pag-increase ng glucose in blood, watch out for those taking this with diabetes. Okay siya for clients with normal kidney function, but not to be given with digoxin. Again, because of the potassium loss. So, chlorothiazide, bendroflumethiazide, and methylclothiazide. Next is loop diuretic, furosemide or Lasix. It's a high-seating diuretic and it acts on the ascending loop of Henle. It inhibits chlorine transport of sodium into circulation. So again, di ba, sodium, chlorine, it attracts water. So dumadami din ang lumalabas na ihi. It's more potent, it's a more potent diuretic than thiazides, but not effective as an antihypertensive agent. Among all of the diuretics I mentioned or I will mention, it's only the thiazides that are effective for hypertension. Tapos, pang mild lang siya na hypertension. It causes sodium, water, potassium, calcium, magnesium, and increases renal blood flow. Again, it's not used in conjunction with digitalis. Why? Because of potassium loss, increasing digitalis toxicity. Pero, because furosemide is a high-ceiling loop diuretic, mabilis siyang magpaihi. Sometimes you will see in the clinicals that even with digitalis, binibigyan pa rin ng furo initially. Kasi ang goal is to make the diuresis fast. Mabilis mawala ang congestion. So, pwedeng bigyan initially ng furosemide. Pero kailangang i-monitor maigi na hindi aabot sa digitalis toxicity. So again, just because of the reason that the furo is a very potent diuretic, no? Lalo na pag merong severe congestion ang heart. Also, in physiologic changes such as hypotension, ototoxicity, skin disturbances, photosensitivity, it can occur. Furosemide is given as an IV push, but do not give it too quickly. You have to give furosemide slow IV push. Okay, how slow is slow? Ideal is 1 cc 1 minute. Why? Because if you give furo quickly through IV push, it will increase risk of ototoxicity. Okay? Third is osmotic diuretic or mannitol. It increases osmolality and inhibits sodium reabsorption, this time sa proximal convoluted tubule and loop of Henle. Again, ano yung na-excrete from the human body because of this? Sodium, chlorine, potassium, water. It's used to prevent renal failure and also decrease intracranial pressure and decrease intraocular pressure. But most of the time, mannitol is used for cerebral edema to decrease intracranial pressure. Diuresis occurs fast within 1 to 3 hours after IV administration. Mannitol is given using an IV filter. Kasi ang mannitol, no, you should warm it if crystals appear in the bottle. And to make sure that no crystal will enter the circulation once given IV, best to give it using an IV filter. Next is carbonic anhydrase inhibitor or acetazolamide. It blocks the action of carbonic anhydrase and that is needed to maintain acid-base balance. Now, it causes increased sodium, potassium, and bicarbonate excretion. If mannitol is mostly used for cerebral edema, ang acetazolamide naman is mostly used for increased intraocular pressure. Sa mata naman siya. Usually sa may open-angle chronic glaucoma or glaucoma in general. The fifth is potassium sparing. From the word itself, it does not excrete potassium. It's a weak thiazide. No? It's weaker than thiazides and loop diuretics and mild diuretic lang siya. Kaya nga best siya if kino-combine with another diuretic. It blocks aldosterone receptors. Aldosterone is an important hormone na nagre-regulate ng fluid electrolyte balance. It acts primarily on the distal convoluted tubule and collecting duct. Again, to promote sodium and water excretion, but it retains potassium. That's why it is best combined with digitalis. Pero dahil nga weak siya, if we want faster removal ng congestion, initially, pwedeng ibigay ang furosemide. Okay? Next are antihypertensives. When we talk about hypertension, there's increased cardiac output, there's increased systemic vascular resistance, there is vasoconstriction or pagsikip ng blood vessels. And the antihypertensives generally do what? They generally cause vasodilation. And these are the antihypertensives we'll discuss: diuretics, sympatholytics, direct-acting arterial vasodilators, angiotensin-converting enzyme or ACE inhibitors, angiotensin 2 receptor blockers, direct renin inhibitors, and the calcium channel blockers, some of which we have already discussed, lalo na doon sa nervous system drugs. So diuretic, nabanggit ko kanina that thiazides are the only diuretics na okay for hypertension, which is hydrochlorothiazide. It promotes sodium depletion, kaya nagdi-decrease yung ECF volume. And it's a good, effective first-line drug for only mild hypertension. So take the medication with juice or with meals for better absorption, better early in the morning, and if there is a sore throat, watch out and inform the physician right away. It may be an adverse effect of the drug. Next are sympatholytics. When we say sympatholytics, they block the action of the sympathetic nervous system. And we know that the effect of sympathetic nervous system on blood vessels is constriction. Therefore, if you block this, it will cause vasodilation. First are the alpha adrenergic blockers. So vasodilation, maintain renal blood flow rate, good siya for hypertension, and also for those with lipid abnormalities like mataas yung cholesterol. Safe siya for those with diabetes, and it does not in any way affect the respiratory function. Pag sinabi nating selective, selective lang siya only for alpha, non-selective, even beta. Okay? Next are the beta adrenergic blockers. They reduce cardiac output because, again, they diminish sympathetic nervous system response para mag-decrease ang basal sympathetic tone, causing diminished vascular resistance. Therefore, nagdi-decrease yung blood pressure, including the heart rate, the heart contraction, and even yung renin. Renin is a hormone secreted by the kidney, which affects blood pressure. So again, they are the olols. Next are alpha-1 and beta-1 adrenergic blockers. They both block alpha receptors na specifically controlling the blood vessels, so vasodilation, and they block beta receptors, specifically decreasing heart rate and decreasing myocardial contraction. At dahil alpha and beta ito, no, they might initially cause orthostatic hypotension. If patients is at risk for developing orthostatic hypotension, we should always monitor the blood pressure. We should always assist them, especially from a lying position bago biglang tumayo. Huwag gagawing biglang tumayo. Dapat dahan-dahan ang pag-ambulate, mag-side lying muna, then slowly sit down, dangle the feet on the floor, and then dahan-dahang tumayo. It could also cause GI disturbances, nervousness, dry mouth, fatigue, which is typical to the effects ng parasympathetic nervous system naman, no? Because they are sympatholytics. Next are the centrally acting alpha 2 agonist. If you remember again, alpha 2 is already controlling the action of alpha 1 when it comes to vasoconstriction. So agonist ang gusto natin. It's methyl dopa and clonidine. These two can easily cause dry mouth. No, it's a common complaint of patients taking this drug. It can decrease sympathetic response from the brain stem to peripheral vessels directly, no? Because they decrease sympathetic action, nag-i-increase yung vagus activity na nagko-control ng blood pressure, nagdi-decrease ang cardiac output, and nagdi-decrease din yung mga neurotransmitters responsible for the sympathetic action, such as epi, norepi from the adrenal medulla, and lastly, yung renin from the kidneys. Next are adrenergic neuron blockers. They are peripherally acting sympatholytics, which are potent antihypertensive drugs. They block norepi. Now, they block its release from the sympathetic nerve endings. And because it's the actual neurotransmitter that is being blocked, but not just the receptor, no, nagkakos talaga siya ng decrease BP, cardiac output, and vascular resistance. Reserpine, guanethidine, and guanadrel. Kaya lang hindi sila masyadong ginagamit kasi ang mga gamot na ito, lalo na yung reserpine, they have been linked now to breast cancer or even suicidal depression. Okay? Next are the direct-acting vasodilators. From the word itself, they direct-acting vasodilator. Sila ay mga potent antihypertensive drugs na nagdadilate ng mismong blood vessel because they relax the smooth muscles of the blood vessel, mainly the arteries. So, hindi siya via the brain, via the nerves, but directly acting on the smooth muscles of the blood vessel. So, because of that, nagde-decrease yung BP, nag-i-increase din yung blood flow going to the brain and kidneys kasi yung mismong artery yung nagre-relax, yung lumuluwag. It can also cause sodium and water retention on the other hand. So, what are these drugs? Hydralazine, minoxidil, nitroprusside, and diazoxide. Okay? Hydralazine is very common. Nitroprusside is also cautiously given because it can cause, says it can cause cyanide poisoning. Nitroprusside then is photosensitive. The actual drug is photosensitive. So, cover the bottle, lagyan ng tubing with foil kapag ibinibigay siya. Next are the ACE inhibitors. The ACE inhibitors inhibit angiotensin 2. And angiotensin 2 is a potent vasoconstrictor. It also blocks release of aldosterone, which will then promote sodium retention and potassium excretion. Captopril and enalapril are very common maintenance drugs for hypertension. Meron siyang primary side effect, and that is constant irritated dry cough. No? Importante din na i-monitor yung renal function, syempre, kapag magte-take ng mga maintenance drug na ito. It should not be taken with potassium-sparing diuretics and drugs that contain potassium for risk naman of hyperkalemia. Kasi maaring mag-cause ito ng pagdami ng potassium level sa blood. Next are angiotensin 2 receptor blockers. Similar to ACE inhibitors, nagpe-prevent din sila ng aldosterone. It blocks angiotensin found in the tissue while the ACE inhibitor blocks the actual enzymes in the conversion of angiotensin 1 and angiotensin 2 as common vasoconstrictors. Again, ito ay mga normal na maintenance drugs, losartan, olmesartan, telmisartan. Direct renin inhibitors, it binds with renin, causing a reduction of angiotensin 1, angiotensin 2, and aldosterone. Hindi siya common na binibigay kasi from the renin itself, it may affect the kidney function because it's the enzyme of the kidneys. Calcium channel blockers, they block calcium in the vascular smooth muscles. Therefore, nagdi-decrease ang muscle contractility. At pag nag-decrease ang muscle contractility, nagpo-promote ito ng vasodilation. Highly protein bound ang mga gamot na ito and meron siyang short half-life. So, verapamil, diltiazem, amlodipine, felodipine, nifedipine. Again, always check the pulse rate. Okay, next group of drugs are the anticoagulants. These drugs act prophylactically to prevent blood clot formation, specifically in the vein. So, pinaprevent ang clotting. Kanina natin gustong ibigay ang mga gamot na ito. These are for clients with vessel disorders and those at risk for thrombosis, embolism, tapos yung mga inoperahan sa puso, like yung may mga artificial heart valves, kasi at risk sila na magkaroon ng mga clot. And also those na nagkaroon ng cerebrovascular accidents also. So, kung magkaroon ng blood flow or clot sa mga ugat na nagsusupply ng blood sa ating mga cells. Okay? Heparin and warfarin are anticoagulants. Heparin can be given sub-Q or IV. It inhibits thrombin, which prevents conversion of fibrinogen to fibrin. So the fibrin strands, which allow clotting and prevent bleeding. Warfarin, on the other hand, is only given per orem. It depresses the liver synthesis ng vitamin K, clotting factors. So, yung prothrombin, no? Also, the other clotting factors, 7, 9, and 10. What are the side effects? Heparin can cause itching, burning, bleeding, or even ecchymosis, while warfarin can cause anorexia, nausea, vomiting, diarrhea, abdominal cramps, rashes, fever, and stomatitis. Now, if there are unwanted effects ng anticoagulant, no, may mga antagonists. Okay? Meaning, the drugs which can control or reverse its action is protamine sulfate for heparin and warfarin vitamin K. So, importante na minimeasure ang INR ng mga patients na ito, especially when giving warfarin, because warfarin can be given as a maintenance drug at home. Importante ang pag-measure ng INR. It's the International Normalization Ratio. It's a comparative ratio of the prothrombin time, which is used to monitor the effects of warfarin. Normal value is 2 to 3 o kaya minsan 2.5 to 3.5. So, importanteng minomonitor to para malaman kung kailangan na bang ihinto yung gamot, magbigay ng antidote kasi at risk na sila para magkaroon ng bleeding ba o kaya magkakaroon ng thrombosis or kulang yung pagbibigay ng gamot. Okay? Antiplatelets, on the other hand, prevent thrombosis in the arteries. It suppresses platelet aggregation, especially sa MI and CVA. MI is myocardial infarction or heart attack. CVA is cerebrovascular accident or stroke sa brain. Okay, so ang heparin at warfarin, it prevents clotting sa vein. Aspirin, it prevents clotting sa arteries. Before, we have studied aspirin as an NSAID. Pero sabi nga natin, ang aspirin ay may antiplatelet activity. Long-term and low-dose therapy, it's effective to prevent thrombosis before or after MI or CVA attack. Maaring binibigyan ng aspirin ang mga patient na post-MI or post-CVA para hindi na ulit mag-clot at hindi na maulit yung heart attack or stroke. Because it inhibits cyclooxygenase, it's an enzyme needed by platelets to synthesize thromboxane. Again, aspirin is per orem. Hindi pwede sa may mga peptic ulcer or liver disease. Enteric-coated kung merong talagang severe GI upset, and because of its prolonged antiplatelet activity, it must be discontinued 7 days after surgery. Baka magkaroon ng bleeding or severe bleeding even with extracting a tooth, no? Kung magpapabunot ka lang ng ipin, you have to tell that you are taking aspirin because bleeding might not stop pag inoperahan ka. So both for anticoagulants and antiplatelets, we watch out for bleeding tendencies. Okay, next are thrombolytics. Thrombolytics are for thromboembolism. Remember that anticoagulants and antiplatelets only prevent clot, but they cannot dissolve clots. The one which can dissolve clot are the thrombolytics. In thromboembolism, there's already an occluded artery or vein because of a thrombus or an embolus. Thrombus sa mga malalaki natin na ugat, no, nag-clot, and then ang thrombus, pag nag-break, pero hindi naman na-dissolve, liliit lang yung clot, magta-travel all throughout, magiging emboli, at pwedeng bumara sa maliliit pa na ugat. Okay, which results in ischemia and causes necrosis of the tissue. Thrombolytics can dissolve clot because they promote conversion of plasminogen to plasmin, and this destroys the fibrin in the blood. Streptokinase, urokinase, altipase, retiplase, tenecteplase, meron pa yung TPA, tissue plasminogen activator. Okay, streptokinase, urokinase, no, they can cause urticaria as a side effect. So para ba silang nangangati sa kanilang skin as an adverse effect. So thrombolytics yung kailangan. Pero magaling ito na mag-dissolve ng clot if mabilis din itong naibigay when clot has formed already in the blood vessel. Of course, because it dissolves clot, parang anticoagulant and antiplatelet, watch out for bleeding tendencies. Assess CBC, prothrombin time, 1.25 to 2.5 times control level. Yung INR ulit, 2 to 3 or 2.5 to 3.5. Know that it is contraindicated for a client with a recent traumatic injury. Baka lalong mag-bleed o mag-bleed yung nag-heal na wound. Monitor for active bleeding during and after therapy. Watch out for dizziness, palpitations, nausea, itching, hives, flush, fever, dyspnea, bronchospasm, hypotension, or cardiovascular collapse. And because these affects the blood vessel, avoid aspirin, avoid NSAIDs for pain. Kasi nga, di ba, meron silang antiplatelet activity. So baka lalong mag-bleed. Acetaminophen can be substituted for pain. As much as possible, avoid venipuncture or arterial tests because again of the risk of bleeding. But if again, you really need to do this, syempre kailangan monitor closely the bleeding. Now, merong antidote, okay, the plasminogen inactivator, and that is aminocaproic acid. Kung meron ng severe bleeding, aminocaproic acid can be given for excessive bleeding as a result possibly of heart surgery, severe trauma, abruptio placenta, or ito nga, pagbibigay kasi ng thrombolytic drugs. Si aminocaproic acid, so pag binigay mo yan, syempre expected mo, hihinto ang pagdurugo. Severe bleeding, side effects, dizziness, headache, orthostatic hypotension, and thrombophlebitis also. Okay, so sa Homan sign, i-check din kapag nagbibigay ka ng aminocaproic acid. Next are antilipidemics. The serum lipid values, cholesterol, triglyceride, LDL, and HDL. May iba pang mga laboratory tests that may help determine the lipids in the body, yung homocysteine, saka yung high sensitivity C reactive protein. Both are tests linked to increase fats. At the same time, si C-reactive protein, bukod doon, nagdedetermine siya kung may presence of inflammation, which indicates a risk also for many coronary artery diseases. Okay? But what are the drugs that lowers cholesterol or lowers the lipid levels in the blood? First are the bile acid sequestrants. Bile emulsifies fats. So, tumutulong sila para mabilis mag-emulsify yung mga taba sa ating katawan, especially sa blood vessels. Cholestyramine, resin, cholestypol, cholesevelam. No? Ito ay yung cholesevelam, it's a new bile acid sequestrant drug na may few side effects. Okay? Fibrates, so mga fiber, kumbaga fiber, para mas mabilis na matutunaw ang mga kinain. Nicotinic acid or niacin, cholesterol absorption inhibitors, so again, inhibit absorption of cholesterol. And yung mga statins, these are the most common maintenance drugs to lower cholesterol. Atorvastatin, fluvastatin, rosuvastatin, simvastatin. Although these drugs, no, pag matagal mo nang tinitake, it can cause naman flushing of the skin. Statins also cause severe skeletal muscle adverse effect. Watch out for rhabdomyolysis. Isa siyang severe skeletal muscle adverse effect wherein nagre-release ng myoglobin, and very harmful ito to the kidneys. But importante din na sa statins, nag-check din ng liver enzymes. What are the considerations? So again, may cause liver disorder, GI upset, eye problem, decreased libido, impotence, and flushing. Drug should be started at low doses. Unti-unting tataasan. Of course, importante na pag nagtitake ka ng gamot na ito, i-decrease mo din yung fatty foods in your diet. It may take several weeks or even months before the blood lipid levels decline. Kaya pag nag-start ka nito, monitor the blood test as ordered, usually pwedeng every month, every 3 months, or up to 6 months. And do not stop the drug abruptly. Taper bago mo siya totally ihinto. Just additional, no, si cholestyramine, cholestypol, minimix yan para siyang juice, mix well with water or juice, but constipation may occur. For GEM, Fibrocil, monitor the blood glucose, especially for people with diabetes. And nicotinic acid, large doses can cause vasodilation na pwede mag-cause ng dizziness, fainting, or even orthostatic hypotension. Last are the peripheral vasodilators. These increases blood flow to extremities used for peripheral vascular disorders of arteries and veins, which are more effective for vasospasm rather than vasoocclusion. Okay? Isoxsuprine or Vasodilan, isa siya sa mga common. Pentoxifylline is also common. No? Um, Sometimes if patients experience nausea and vomiting with isoxsuprine, for example, sometimes you need to tell it to the doctor kasi kailangang babaan yung dose. Okay? But again, these are peripheral vasodilators. Kaya minsan pwede itong ibigay even with, not with just vasoconstriction, hypertensive alone, but ito ay pwede even dun sa mga nagpe-preterm birth, kasi may vasospasm dito sa uterus, so pwedeng ibigay ito to prevent premature contraction of the uterus also. Okay? Considerations, assess for pallor, cold extremities, and pain, kasi nga peripherally, it's a vasodilator. Baka wala ng blood flow dun sa kamay at paa. Can cause tachycardia, orthostatic hypotension, flushing, headache, dizziness. Initially, the desired therapeutic response may take weeks to months. Smoking alcohol contraindicated. And again, bawal yung mga aspirin, salicylates because to help prevent platelet aggregation. That's the end of the topics for the cardiovascular drugs.